joining. We're really excited about the direction we're heading in, and this meeting will have kind of a new focus on our local teams and the CHN members that are in your regional area. So that'll be kind of the focus of today's meeting. Okay, so I'm going to go ahead and start screen sharing. Let's see. Amanda, can you enable me to share?
Oh, yes.
Thank you. Wonderful. So we're unlike previous meetings, we're not going to do general intros because we're going to really focus on spending time together in our breakout room. So we will definitely get to engage with each other in a kind of more focused way. So don't be sad, your voice, you'll get to engage with partners, but it'll be a bit later. I'm just waiting, Amanda. It still says I can't share.
Oh, I'm sorry. I thought Cindy had done it. Yes, hold on one sec.
Oh, am I a co-host already?
I just did it. Sorry, I was putting something else in the chat. There you go.
Wonderful. So here we are. We are live. Can everybody see my screen? It's loading.
Yeah, it'll be here in a minute.
Wonderful. So here we are, recentering in our February community meeting for Climate Health Now. And in the winter, we've been doing some really kind of more deep strategy sessions, and we've come out with a lot more clarity about how to be really effective this year. And part of that is that we have, I'll go back to this. We've updated our mission statement. So we want to share this with you. I think, we've been at this for about a year and a half, and we've gotten more and more clear on exactly what our role is in the climate movement. So to make everybody as inspired as I feel when I read this, I'm going to go ahead and read it because I think it's really our North Star, that we are medical professionals in California who are protecting and improving the health of all people by advocating for urgent, equitable climate solutions. We organize and mobilize the medical community's collective voice to advocate for our patients' health today and a livable climate tomorrow by calling for a rapid and just transition to a clean energy economy. So that's what we're after. And part of what we'll do today is talk about building up the local connections with our different regions and how that's going to help us achieve this big mission. And just kind of reviewing, our campaign focuses that have different aspects of what they're working on in order to achieve that rapid and just transition to protect everybody's health. We have an action team that's led by Karina, who's one of our key leads, that's focused on oil and gas and reducing the supply of oil and gas in California. We have an electrification team that's seeking to electrify all of California, fueled by renewable energy, and that's led by Amanda, and there's co-leads too. I'm the kind of key lead for the Health Insure divestment campaign. And then the other action team is about healthy voting, and Cynthia's been leading that, and they were very, very active last fall. And then today we'll start talking about our emerging team that we're really going to invest a lot in this year, and that is a community organizing team. And that's helping to build the local relationships with our different hubs, which we'll talk about more. So, manifesting our mission this year, how are we going to do that? Just that snippet of one line of our mission is that we organize and mobilize the medical community's collective voice. So how are we doing that? I am really excited that next week, has anybody here heard of Marshall Gans? maybe Margie and others. So he's a kind of legendary social justice community organizer, and he was involved in civil rights organizing in the 60s. He was involved in the farm workers movement in Cesar Chavez and Dolores Huerta. And more recently, he was a big part of Obama's first campaign in 2008. So he's really good at this. And I'm taking a class with him. And the class is kind of focused on how to organize. And I'm obviously applying that to the medical community in California. So the way he defines organizing, because that is in our mission, is that it's required to make democracy work. And what we're focusing on this year in this new community organizing team is developing the leadership of others, so our medical professional colleagues, as we learn to turn our communities into a constituency and transform our resources into the power that we need to achieve our goals. So I don't use the word constituency all the time, but it's a body of voters who, in a specified area, who elect a certain, elected official or legislator. So what we're doing with our hub teams is we are identifying our Climate Health Now, climate activated medical professional colleagues in California, and kind of becoming a constituency that it won't stop talking about how the climate crisis is a health crisis and we need to implement policies immediately. And that's what we're going to be doing this spring. And I'll talk about it in a minute. So we're organizing ourselves so that we are a known constituency to all of our elected officials, kind of, helping them understand the health implications of the climate crisis in California. And so, what we're trying to leverage is, I think we talk about this a lot, that when Americans are polled, they typically vote that the profession they trust the most is nurses. The second most trusted profession is doctors. And the third is pharmacists. So we really see that as kind of our greatest tool in the climate movement, is leveraging that trusted voice in order to depoliticize climate and to make it something that is more a unifying theme, where it's about the safety of our children, the safety of our families, and not the political issue that the fossil fuel industry has made it, or not the partisan issue, I should say. So we are, leveraging our voice to build public support for climate action policies and to pressure our legislators for urgent climate action. And we're this year, because of all that kind of strategy focus and conversations that the leadership team has had, we're making it a really foundational priority to develop every one of our 467 Climate Health Now members to learn how to turn our climate and health and equity concerned medical colleagues, those that are already part of Climate Health Now, but future members also. So what we're trying to do is to help support the community that we have to become a really effective team to leverage our unique practice of art in translating science into a story that resonates personally and motivates people to make change in order to be healthy, whether that's dietary changes for treating diabetes or policy changes to stabilize our climate. We're really the translators of science, and we can use our trusted voice to help people understand that it's not about polar bears, it's about asthma, it's about heart attacks, it's a personally relevant issue. And so what we're trying to do is to translate that science into a story that people can really understand is personal, in order to motivate the social will and policy level changes that we need. So, we have the gift, being physicians, of an extensive amount of education and scientific training, and we have really, well-organized professional communities. And so we have a lot of, social influence, and then we have the social trust of our professional voices. And, this year, this picture in the bottom right, that's a picture of physicians and nurses and healthcare team members in last summer after the murder of George Floyd, and there was the kind of white coats for Black Lives movement. And I think that's a really powerful example of leveraging our professional trust and influence to kind of elevate really important social justice issues, whether it's racism or the climate crisis. And these are some other fun pictures of visits to this in the bottom left, actually. We were in the office of current Vice President Harris when she was a senator, and this was in September of 2019. And this was a meeting that we organized with, there were like 28 of us or so on the climate strike day, and we were meeting with her legislative staff, and our pretty singular message, which we kind of told stories about and developed in different ways, but the message was climate change is a health emergency. We can't take care of people sufficiently in our clinics and hospitals. We need you to implement policies upstream to protect our patients because this is a crisis. And so what we're going to be talking about more our kind of action this spring is having more of these office visits where we show up in white coats and with our stethoscopes and kind of the symbols of our role in society, that we are here to protect people's health, to the offices of policymakers to kind of very vocally frame climate action as a health emergency. So So we're starting to kind of map out who we have in the Climate Health Now community now, and to build up the local hubs. So we started to do this before COVID, and then it became more challenging, but we're circling back to this. And so today, right now in the California legislature, bills are being introduced, and both on the Assembly and the Senate side. And the deadline for those bills for this legislative cycle, and Kathy, please correct me as you see fit, the deadline for those bills is coming up. And in the whole legislature has a recess in March and April. So March 26th to April 4th, they're going to be on recess. And this is typically a time where there's more meetings in district. So, my assembly person, Buffy Wicks, she will likely be more available to have meetings during this week where they're not in Sacramento. And so what we are working towards is developing, these 6 hubs that we have basically in Sacramento, the East Bay, San Francisco proper, the Peninsula, San Diego, and LA. That's where we already have really strong clusters of, 10 to 60 Climate Health Now members. And so what we're doing in the next 8 or so weeks is getting to know each other, which you'll do shortly in the breakout rooms, and planning meetings with our legislators. So, whoever is your district assembly person or your district senator, and planning meetings with partners. So whether it's Mothers Out Front or Sierra Club or 350 chapters, so that we show up and we talk to them about how we, as their constituencies, as the people who vote for them, and as the medical community, are extremely concerned about climate and are expecting them to treat the climate crisis as a health emergency, because it is. So this is kind of what we're leading up to, and it'll be a really great way to develop more local partnerships. So like I started to talk about, the bills are being introduced now. We have about 9 more days until kind of they're all introduced. And then this recess is when we're going to be talking to them and sharing our extreme concern for the climate crisis. And the goal of these meetings is first and foremost to get to know your local Climate Health Now partners and who's in your local area, because that's really your team that you're going to be most effective with. Also to get to know your partner organization. So, I live in Berkeley, where Kathy Durbin lives, who works with 350 Bay Area. And so, the kind of partners that we have locally will depend on, where different chapters are present. But so our partner organizations, there will be some themes throughout the state, but there will be some local variation. So this will be an opportunity to get to know them. So it's not going to be that we're, showing up for Zoom meetings with our legislators just with Climate Health Now necessarily, but we're definitely interested in having that be with our partners, partner organizations. So this will be an opportunity to get to know them. It'll also be an opportunity to get more confident and fluent with talking about the health impacts of the climate crisis, and we will support everybody in doing that. And it'll be a way to educate our elected representatives about how when we speak about climate, the most effective messaging frame that motivates support for climate action is when it's framed as a health crisis. So when we talk about climate, as purely environmental, although we love polar bears, polar bears don't motivate people when they're voting. So we want to help our legislators understand that talking about climate as a health crisis helps to build support for the action that we need to address it. And then the last goal of these meetings is to just get familiar with them, because I'm curious right now, can you raise your hand if you've been in a meeting with an elected official kind of representing yourself as a medical professional? I'd be curious to see. 5. Yeah, so a minority, it looks like. It's not something we learned in med school, that's for sure. But it's something that is critically important in the moment of the climate crisis, that we become very civically engaged, because, because of the climate crisis, advocating for policy solutions is really part of being, it's part of our professional responsibility now, but it's something that we just haven't been trained on. So we're here to help. And so the meetings, there's a formality for sure to these meetings, which can be very intimidating. And, we're gonna kind of help everybody learn how to schedule them, how to organize the meeting, how to create agenda so that different people can share, how to follow up afterwards, and how to get to know your legislators and develop relationships so that they respond to your emails, and know that you are looking at them and how they're voting and leading on the climate crisis. Karina, did you have a question?
No.
Okay. So we're going to stop for a moment now, and because, like I've said a few times, is we are organizing our people, organizing our community so that we can be very effective and we can really influence leaders and policymakers. So right now, Amanda, would you be able to put in the chat, we have created a new demographic form. And we're actually going to take about 4 minutes right now to ask you to complete it, because this is really important. This is how we know where we have members, where we have influence, and how to build teams and support teams. So I'm going to invite everybody to, does everybody see that link that Amanda just dropped in? So if you could take a minute, and I'm going to actually set a timer for 3 minutes, and then we will reconvene once everybody's had a chance to do it, because this is really the what's going to inform the year ahead, is knowing where our team is. And this is a brand new demographic form. So Adrian, thank you for that question.
Yeah,
so this
is different.
Yeah, we're upping our game. We've learned a lot. It's more focused. So yeah, if you could please do this one, because it is brand new. The debut is today. Oh. And if you could start raising your hand when you're done, just so I have a sense of where people are at. And Amanda, if you could put it in the chat again, it looks like Megan was asking for it because you just joined.
And one quick plug while you're putting this in, if you can put your district number as opposed to the name of the person who's elected, that would be especially helpful. We can back it out, but it would be really helpful to just have the number.
I'm not finding the number at that website. It just took me to Judy Chu. So I don't know the number, but I'll find it somewhere else. I'll keep going.
Oh, sorry. Who? I don't know whose voice that is.
Mark.
But is that Mark?
Yeah.
Oh, okay. The Mark, you're talking about how to find your assembly district number or Senate district number.
Yeah, I just don't know the numbers. I went to that link, but it took me to Judy Chu, which is clearly not what you're looking for.
Right. Try that link I just put in the chat. That's to find your state assembly district and state Senate district, and it'll give you the number. You just put in your address.
Cool. Thanks.
Yeah.
Some of the questions need an other choice for public health people. We don't practice, we don't have a specialty like physicians do, and you can't fill out the form unless you fill it out. So it needs
Okay.
to be revised.
Yes. Thank you,
point.
Kathy. Very, very good point. This is the live debut of this form, so thank you. I'm gonna see if I can edit that right now, actually.
That'd be great. Yeah, and please do share other feedback. It's really helpful. And thank you for doing this.
That was cool. Can you do that again? Uh-oh.
I have no explanation for why that happened. Oops. Okay. Okay, so I think we'll give it 1 more minute. Does that sound okay? Okay, 1 more minute. And thank you, Karen, for that feedback on PAs. We will make sure that the form allows you to write specialties too. Thank you. Okay. So thank you for doing this. It's really important. Sometimes forms can be annoying, but this is really how we're building our team. So appreciate your taking the time. And if you didn't get a chance to complete it, if you could, this morning, that'd be really helpful. And so now I'm really excited about this breakout. So we have a team of regional facilitators. So Layla, are you on the call? I can't hear you, Layla, if you're here. I don't see her yet. Okay, so Cynthia will start the Sacramento team. And it's Sacramento and Northern California, including Marin. And then Margie is going to be facilitating for the San Francisco breakout. Amanda will be facilitating for the East Bay. And then Lisa actually should be joining within a few minutes. So actually I will start with Lisa I'll start at the Peninsula group. And then Karina will be doing the LA area. And Christine will be leading the San Diego breakout. So Christine, are you okay if I shift to the peninsula for now?
Yeah, that's
Is
totally
that
fine.
okay? Okay, wonderful. So the goal of
I'm
these
gonna-
breakouts, go ahead.
Oh, no, go ahead.
So the goal of these breakouts is really to get to know each other, to get to know, where you work, what you do, kind of share about if you've had experience in meeting with legislative officials before, and to just, start to develop real relationships. And I think many people probably had this experience, but I can say my partnerships and relationships in climate advocacy as a physician, they're some of my best friends. So you might find a best friend in this breakout room, which would be great, because this will be the team that you're working with this in the next, this spring and beyond, for these advocacy meetings with our legislative officials. So we're going to give this a shot. Amanda, can you guide on the
Okay,
breakout?
so I'm gonna open the breakout rooms, and then it should, you guys, you'll have to tell me if this is working for you, but you should be able to assign yourself into the geographic region that best corresponds to where you are located. And for people, like I know, Heather, you had said you live in one place but practice in another, you can choose what you feel is more applicable, or the community to which you sort of identify more. And then if people are having trouble joining, you can also message me and tell me where. I can also assign you to a room. So if that is an issue, let me know.
Okay, and then so each of the facilitators has some kind of discussion questions, and we're going to all reunite here at 9:20. So we'll bring you back at 9:20, and then we'll kind of share out about how the discussions went. And then Bonnie, you can just choose whichever one you feel like you should be in.
And then
can you
I hope it
just tell us how we assign ourselves?
So do you guys see an option on your bottom control panel that says breakout rooms?
No.
Yes, I see it.
Some people do. Okay.
Yeah.
It may have to do with what version of Zoom you're using. So if you see that, click on breakout rooms, click on that button, and then you should see 6 different named rooms and with a button that says join. Do people see that?
I don't see the join part.
Yeah, I don't see
Okay.
the join button either.
Huh,
We see the
okay.
breakout rooms in progress, but
In progress. Okay. Well, I'm also.
here now there's a join.
Okay. I'm
If
also.
you go
just-
over the numbers, it turns into a join.
Yeah,
just
you may have to
drag over the
hover.
numbers.
I see it now.
And I'm also going through the list because I know where many of you live, and I'm just putting you in your group. So
Me too. I'm assigning people, and Lisa just
Okay.
joined, so
I
I'm
saw
gonna
that.
go
I
to
assigned
San
her to.
Diego.
Yeah.
East
Okay.
Bay. I'm helping too. We'll get you in
Great.
there, and we'll come back in 20 minutes.
Tom Newman, are you Peninsula? Is that where you would identify with?
Yes.
Yes. Okay.
And Juan Aguilera, you're San Diego or LA? I forget.
I'm actually at Stanford.
Okay, Peninsula. Okay, thank you for joining. Karen Finkley, where would you like to go?
I can I'll go to the Sacramento.
Okay, wonderful.
Sacramento,
Thank you for
Northern
joining.
California.
Great.
No problem.
And
Thank you.
Solomon Amra, where would you like to go?
What about Susan Penner? East Bay?
Yes, I'm East Bay. Thanks.
Okay. Trisha Ross, how about you?
Or Tom, I'm sorry, I missed Tom. Where you want to go to
I'll
SF?
put Tom.
Okay.
I put Tom into Peninsula.
Okay, great.
Oh yeah, and Lisa. Yes, Lisa. I will. Sorry. Okay.
Good.
There. So we have Solomon, Trisha, and then I see another Susan. I'm not sure who's the other Susan is, but if you're not assigned, where would you like to go? I'm looking to see.
And Rahel is here. Hi, Rahel.
Yes, I put Rahel into Los Angeles.
Oh, you did? Okay, good, good. That's cool. I'm
Yeah.
glad she joined.
Do you see it? Rahel, did that work? So Ashley, I don't know if we should, so we have Susan, Trisha, and Solomon. I don't,
yeah. Okay, I can look up Trisha real quick on Slack and see which
Okay.
channel she's in.
I'm Los Angeles.
Oh, okay, cool.
oh, perfect. Here, I
Okay.
can do that real quick. And then Solomon Amro, can you hear us?
Solomon is
I'm also
in-
looking to see if maybe he filled out the form.
Yeah, I can't tell. Okay, I'm gonna go to San Diego because they only have 3 people in there.
Okay.
Okay,
So, okay.
so we're gonna come
And
back.
Ashley, did you set the timer?
No, but 9:20.
9:20. Okay.
Yeah. Okay.
So, okay. See you soon.
Hi there. Susan, can you hear me? Susan? Okay. Here we go. It's working.
Yay, that was fun.
It's like going through wormholes. Hey, Mark. Hey, Rahel. Thanks for joining.
How's it going?
Good.
That was nice.
That
That
did
worked
it work
well.
out?
I hadn't seen anybody do the breakout room self-selected before. I've
Yeah,
only
that's
seen where the host sort of, but that worked well.
Cool.
Yeah.
Self-determination.
I like it.
Hi, Ashley.
Hi, Rahel. Thanks for joining. I'm hoping we can touch base sometime to chat, maybe today
Yeah.
or something.
Okay.
Yeah, I'll put in the chat my phone number. Maybe just text me when a good time is for you.
Okay, that sounds good.
Okay. So great to see you back. Thank you all for, we're obviously still working out the kinks, but I really hope that you got to get to know somebody more in your local area. I certainly did. And what we'd like now is to share out a couple of highlights. So I'll call on each group and maybe one or two people could share something you learned about somebody, or like a local organizational partner that you kind of thought of that could join for those March, the spring recess meetings that we're going to schedule. So we'll start in the north with Sacramento. Anybody want to share a highlight or two of your conversation?
We have Bonnie Hamilton, who has run for political office and who has a long history of advocacy in the public realm. So I think we've got a power hitter in the Northern California Sacramento group.
I think you're right.
Thank you, Bill. That's so sweet. Thank you.
Awesome. And Bill, you have some background too, right? To draw on.
No, I'm not with any political action. My activities have been local and pushing my hospital administration and the UC leadership, but I'm willing to take on our elected leaders as well. And who knows, maybe run for office someday.
Exactly.
Woohoo!
I like your thinking. Wonderful. Okay, and then we'll move to, what do we do? Let's do East Bay. Who wants to share a highlight?
Jeff, do you want to share?
Okay, my dogs are barking a lot in the background, so maybe just so that's why I'm on mute. So sorry about that. We sort of talked about big picture and small picture, and there's so many different ways to address this. Sorry about the dogs. So we sort of got to know each other a little bit more and figure out what aspects of this we're interested in. We didn't focus so much on which of the assembly people we were going to, try to speak with, but I'm sure that we will get to that. But just sort of more a little bit of our backgrounds and what we have done in the past. So sorry, I'm a little distracted. If anybody else wants to add.
Yeah, maybe one other person from East Bay who hasn't spoken today.
Where was he?
Okay, I'll share a cool thing in East Bay, which is where I live. We've been working, so the air district, who manages and regulates the quality of our air in the East Bay, we've been rallying around demanding that the air district requires the Chevron refinery to install a wet scrubber, which is a weird thing I didn't learn about in med school, but it basically would reduce particulate matter. And so we've last week we showed up at a kind of public comment hearing. They went until 9 p.m., way past our bedtime. And we showed up, and that's one other way to really influence policy change, is through kind of local hearings, which sometimes is really important because a lot of land use issues happen and get determined locally, which have huge climate and environmental justice consequences. So one other highlight for the East Bay. Okay, wonderful. So then we're going to move to San Francisco. We have one or two people who want to share highlights from the conversation there.
Robin, you want to summarize?
Margie, I think you can represent us.
My internet is a little unstable, so I may disappear. So we have such an energetic, experienced group, and passionate, and very involved. So it was really great to meet everybody. We thought about, I mean, and I think three of our six were actually have appeared before legislators, so experienced advocates, and so we do have some experience in that regard. But we also talked about, what are we going to be, how do we identify bills that we are going to try to advocate for? So maybe using Kathy Durbin as a resource, but picking out certain legislation that we would really be advocating for, because it's going to be a busy agenda. And I think the legislature is going to be overwhelmed with COVID relief and economic recovery. So we thought we would try to look for some legislation that allowed us to build a sustainable future while reducing fossil fuels, and maybe that would have more impact or resonance for the legislature. But so anyway, we're thinking ahead.
Yeah. Anybody else want to mention anything from San Francisco? So we, next Wednesday, actually, 8:30 o'clock in the morning, there's going to be a press conference, and Senator Wiener out of San Francisco will be announcing the fracking ban bill that he's introducing. And our very own Dr. Karina Mayer is going to be speaking at that press conference. So yeah, super cool. So, we're figuring this out, but definitely, as a broad umbrella, we have a few bills, and they're still being informed, obviously, but we have a few bills that we're going to make a priority. And then the local priorities will, there will also be a balance of focusing on those. So we together will kind of help determine, and like you said, Margie, our local partners who have much more legislative background is who we look to advise us on where, as medical professionals, our voices best kind of used to support. So it's a balance of the state and the local level. Wonderful. And then we're going to move to the peninsula. So let's see, Juan, you said you're in the peninsula, right? You got your Stanford background. Would you mind sharing some highlights?
Definitely. I was in a group with Lisa and Tom, and I think this experience has been great. We share a little bit of experience when addressing elected officials. I'm learning from the group. I only have a few experience, but in this regard, I think there's a lot of work that can be done. We mentioned how electrification is something that we need to consider, especially since some of the approaches that involve changing building codes might not address the needs for lower income communities, since it may lead to increased rents. So definitely thinking a little bit outside the scope of the initial target, expanding is very important, and also considering every person involved. And you're muted, Ashley.
Great, thank you. Thank you, Juan. Lisa, would you want to briefly mention the equity tool that you brought up? Just like a little overview of it?
Yeah, so I've been talking with the NRDC, who has developed a formal equity tool that when they enter a partnership with any other organization, both sides have to fill this out to make equity a central part of the work that they do. And this has come up in some of our meetings with some of the organizations we've been working with on transportation and on building electrification, where it feels like the message on the disproportionate impact that air pollution has on low-income communities is utilized in the advocacy message, but it is not used in the policy that is being advocated for. And so just to be mindful that when we're lending our voice, we are working with organizations that will say, sure, we're happy to lend us our voice, show us your equity plan, to make sure that when they are using communities that are being disproportionately impacted, it's not just for this advocacy agenda that leaves those communities behind ultimately, which there's a real concern with that with building electrification, because if we change the code but don't go back and help lower income housing electrify, then then what has this been for if those are the communities that are being disproportionately impacted?
Yeah, absolutely. So that kind of making it systematic, that we're, you know, evaluating how anything that we support and our partners, their kind of way of working, that we're centering equity, because that's always about health. So we're working on figuring out how to really systematize that in all of our engagements with partners and policy. So thank you, Lisa, for bringing that up.
Can I just add one other thought on that? Just I think this is an example of where we can use the power of our voices and our professional power to really move the needle too, because as Lisa said, and as many of you all have probably experienced, lots of organizations, I think we've especially seen this with electrification and transportation, they want to be able to leverage our voices. It matters to them that they can say, look at what these doctors and nurses are saying. They're supporting the policies that we're proposing. But we also have some leverage, right? They want to partner with us. We want to partner with them, but we can also, not to make it sound adversarial, but I think this is an opportunity for us to really push the needle on equity and make sure that the focus stays on equity, especially when that hasn't historically been at the center of what, especially some of the, larger groups in this space have always been centered around.
Yeah, absolutely. I see us as the Robin Hoods of social power. Anyway, thank you.
I see Meg. I think Megan just raised her hand too.
I just wanted to ask if it would be appropriate to start offering to local utilities, our voice, to have them enact programs that address social justice and equity, because that's one of the things that we're working on with the local utility is, a lot of low-income people can't really afford to electrify, and then when they do, are their electric bills going to go up so much they can't afford to pay them?
Yeah.
So that's an issue that we are concerned with in the Sacramento area.
Yeah, that came up in San Diego too. Kind of it has to be subsidized, by the richest for the poorest, for sure, with the whole transition, really. So that's a really important point. So yeah, I think that could lead us to San Diego. Maybe Vanessa or Christine, do you want to share?
Oh wait, sorry, Bonnie also has her hand up. I don't know.
Yeah, hi. I just quickly, I just wanted to mention another group called Physicians for Human Rights. I don't know if any of you are involved with them. They do monthly webinars, and they've been focusing presently in the last year on COVID, of course. But I think that this is a group that we could partner with to talk about climate justice. And before COVID, they were involved at the borders, with refugees, and so forth. And so I put their website in the chat. They have a program coming up on Friday on physician burnout and COVID. But again, that's another group that we might want to consider. And also the other is the Bay Area chapter of the Climate Reality Project. They have a whole group on climate justice that they meet monthly again. So I'll put their website in the a chat. And Amanda, as far as connecting with them, they are very easy to connect with. You can send a message, and they've connected with me directly many times.
So I think those would be partners to consider involving in the Sacramento area and other legislative meetings during the recess in March and April. We can invite them to join those meetings with us to develop those partnerships. Wonderful. And then we're going to move.
They are a national group, though. The Physicians for Human Rights is a national group. Yeah, thank you.
Thank you. So maybe Christine or Vanessa, do you want to share highlights from San Diego?
Sure. So actually, Vanessa is a part of a really cool organization, the California School Nurses Organization, and they, I think, did, she's definitely done some great advocacy work, just related to, obviously things that affect kids in schools. And so I'm going to ask her to speak more to that. So she's definitely had experience. And then for me personally, I'm a part of, there's a group called the Climate Action Campaign, which is very focused in San Diego, but they have a healthcare arm. It's the Public Health Advisory Committee. So it's about 10 physicians in the local area who have been asked to speak in front of city councils and our local government bodies about various issues. So I think that they would actually be a great group to partner with. The person who actually runs it, Bruce Becker, is pretty well known, I think, in the climate change and health world. He's just been involved with everything. And so he's been involved with things across the state and nationally. So I think that that's a great connection to have. And then what's great about the group is that everybody has varying levels of advocacy experience, but as we've done more of these things, they've become a lot more involved, a lot stronger. So I think so I think we have a good connection there here in this southern area as well. So two really great organizations I think we can connect with.
Yeah, awesome partners. And then we're going to finish up with LA, if you want to share some highlights.
Yeah, I want Mark to speak if you're still, I didn't look, are you still here, Mark? Yeah, I think so. Yeah. Rahel from Physicians for Social Responsibility LA, who had to leave at 9:30, she brought up, she trains the health professionals to speak and speak to legislative bodies and things. So she made a point that organizing many people to say the same thing and to be consistent, have many voices, repeat sort of the same message is very powerful. And then she said having good data to back it up is when they ask for it is good. And then Mark made a couple points, one that Margie made, but if you want to say, Mark, one was about the explaining and then getting the bills, having the bills pre-selected or.
Sure. So I guess my comment was about, being technical and trying to explain to the legislators and sort of trying to convince them with your logical reasoning about this scientific fact. Not that it doesn't need to be there, but it's often not the key to getting their interest. Their interest is really about what do people think? What do the groups think? They don't understand the details of a lot of the policies that they vote on. What they understand is who's for or against them. And so I was just saying, framing things in that way, I think is really helpful. I wanted to segue to something that was just mentioned about Bruce Becker. And so I'll go back to, and I already forgot the other point that Karina wanted me to touch on, but I don't want to forget this. I don't know if many people on the call are either from Dignity Health or are aware of Common Spirit, but Bruce's organization helped us launch something that's going to go live, I think, in about 10 days, where the entire Common Spirit system has been invited to a 2 half-day training to become climate ambassadors. And Common Spirit Health is now the largest nonprofit hospital system. They have over 120 hospitals. Mm-hmm. And it's a pretty big endeavor. And so it's neat. So I'll kind of keep people up to date about it, but it might be a nice model for other systems. Maybe Kaiser could do the exact same thing. It wasn't that difficult to put together. Yeah. We were able to arrange CME credit, but even more importantly, if anybody is at a Dignity Hospital or has connections there, let me know, because I sense that, the disorganization of big systems, it doesn't really get to the hospitals. Hospitals are kind of all their individual entities. And so we've blasted it in my hospital and several others, but I bet 100 hospitals haven't. And so I'm just trying to get the word out.
Yeah, totally. Mark, thank you. I'm proposing that 4-hour Eco America Climate Ambassador training to be offered through CMA. And if you could share the CME application with me, I would love to copy it.
That
Okay.
was not easy. Let me just tell you that. I didn't do the
Send it my
legwork, but
way.
I will send you who we got it from eventually.
Okay, sure.
Yeah,
We're collaborating. Wonderful. It's super great to kind of just get the lay of the land across the state and to learn about our different hubs. I forgot to show this, but this is a visual of what one of our key focuses is for this year is, right now we're kind of this model on the left where we are, centrally focused, but we don't have as many connections between our members as we need and want. And so what we're working on is building this really strong web of connections between our hubs and across the state. So this is what we're working on. So now, I think some people have already been talking about how to be in touch with each other. So on Slack, we have channels that are local. So we have a San Diego channel on Slack. We have a, LA Slack, channel. And that platform is how people can kind of interact easily. And people's email is also included on their Slack profile. Amanda, in the interest of time, I think we
skip the screen share.
Yeah, not do the screen share, but that's how we interact with each other. But we can facilitate you being in your right channel when you do the demographic form. So that's why that's really important, is because that helps us to organize people and to put them in touch with each other. So but feel free to, write in the chat right now if you were like, oh, I wanted to, get that person's email, just go ahead and do it now. You can direct message them or you can send it to everybody.
And one other thing I just wanted to throw out there about the channels, because we're seeing this with some of our action teams as well. It may, we design, or not design Slack, we set things up on Slack because we thought that would be the best facilitator of how to communicate across the board in this way. But if your hub doesn't want to use, like one action team made a Google group and because they just wanted to use email. So that's, what matters is that we are connected and doing the work. It doesn't necessarily matter where that is. So that's also totally up to, Slack is there, but if it's not going to work for your hub, so be it, just to put it out there.
Yeah, exactly. Local creativity. Mark, you had a question?
Yeah, it's a quick Slack question. I struggle to get things that people put in there to some other place where I can either send it to people or work with it. But maybe I'm just missing a really easy trick, but it's hurting my Slack performance. So does anybody have a quick trick for kind of whether it's a file or whether it's an announcement, how I can move that out of Slack easily?
You should be able to copy and paste any text. And Mark, I would be happy to follow up with you offline if that would be helpful. You should be able to copy and paste anything. If it's an attachment, you can download it to your computer and then attach it to something else. One thing we are still working toward is putting together some tutorials on Slack for our members to use that's like specific to our workspace. Yeah, Bonnie, I hear you. People don't always like Slack. And so that's why I wanted to just put it out there that it doesn't have to only be Slack. But Mark, I'm totally happy to help you.
You just said something that might have been the key, which is I'm not using it on my computer as much as on my phone. Maybe on the computer, it's a lot easier.
On your computer, it's pretty, I would agree. Yeah, it's much easier on your computer. Yeah.
Yeah.
That's what I'll do.
Okay. Yeah. Wonderful. And then just planting a seed. So we are recruiting for hub co-leads, and those will be kind of our organizers, community organizers in the different hubs that we just talked about. So if you really love building relationships, you love talking to people, helping people grow and kind of facilitating community, then let us know. And you can let us know by emailing us at the caclimatehealthnow@gmail.com email. Or you could just kind of step up as we plan these meetings for the spring recess with the legislators. So put that out there. Now I'm going to turn it over to our oil and gas team for some updates.
Yes. Hi, everybody. Karina here. And if anybody else from our oil and gas action team wants to chime in, just do so. We didn't quite have time to update everyone on all of our teams, and there's a lot going on. So we just wanted to tell you a few tidbits and maybe do a few quick actions if we have time. So you can go to the next. So this is just a little list, of what's going on. So the AB 345 setback bill that was introduced last year, the author withdrew, Murat Suchi, and there needs to be a new author before February 19th, which we're not super hopeful, but so that's sort of watching and waiting. And then, as everybody probably knows by now, the CalGEM comments on public health rulemaking is on standby because they delayed their putting that out. So we're going to be ready for that. And then Ashley mentioned the state senators Wiener and Limon are going to propose a bill to ban fracking and some other destructive oil extraction methods, some of the extreme methods that are particularly harmful. They're going to introduce a bill, and Wendy and Jeff from our group gave them a presentation on the health harms so that they're equipped. Whoa, with what happened? No, please. Oh, yeah. So they're equipped with all the data. And then, yes, there's a press conference Ashley mentioned, and Amanda put in the chat on the 17th, which will be live streamed. So we will send out, once we have it, it hasn't been released yet, the link to the YouTube, I think, live stream, so people can watch if they want, but it'll be put on by Senator Wiener and Limon's office, and we'll be there. And we're going to also, we have a verbal comment, and then we're going to have written comments. And then in the Bay Area, there's the updated refinery regulations that Ashley mentioned with the wet scrubbers. That's going on. And then some of the refineries are transitioning to using biofuels. So Jeff is very involved with that, and pointed out that this is happening, this is going to happen. And one of the main things we can focus on is insisting on transparency of their feedstock. So what kind of oils they're refining and where those come from. And because some of it can come from freshly cut down rainforests. So we don't want that. And then, yes, there's, because the Biden-Harris administration put a pause on new oil and gas leasing on public lands, there's been movement within California that we should do the same here. So actually the Central Coast has is trying to revive an act to put a moratorium on that in the Central Coast area. So hopefully that will spread statewide. And then, so then there's Stand with Kern and Stand with LA. So we're going to talk about Stand with Kern, meaning what's coming up, and this is what we want to do right now. So you can go to the next slide, please. And then, so in Kern County, there is a proposal, and then you can go to the next one, to add in one fell swoop 67,000 new oil and gas wells, almost doubling what they already have there, which is 78,000, which is 80% of California's oil and gas production. So they want to, with one environmental impact statement, allow 67,000, which is mind-boggling. So Stand with Kern is that we are supporting Kern County communities, which obviously affects them more, but everyone, of course, and contributes to climate change. But you know, and we all know that the people who live closest to those oil wells are people who are low income and communities of color to a greater degree. So what can we do? So right now we want to do a couple things. And you can go to the next slides. Oops, yeah, this one. So I'm putting in the chat, I just put the toolkit, which contains these plus many more actions that you can take. But maybe right now, if you haven't already signed this petition, can you copy from there? Or we have to copy from the slide, maybe.
It's in the chat. I think people can just click on it. Oh, sorry, the petition itself.
Yeah, the petition.
Let me see. I can put the link to the petition in the chat.
Thank you. Yeah, so that's super easy. That's a petition that basically is asking the Kern County Board of Supervisors and Governor Newsom to not allow this 67,000 new oil and gas. It's well written and simple, and it's not controversial or aggressive in any way. Yeah, and so that's one thing, if we can all do that right now. And then as you click on that, there's a couple more easy, or several more easy things. Some are in the toolkit, some are right here. So one is, this would have to happen ideally by today, but the true deadline is by tomorrow at 12 p.m. to call this number, the 844 number, and submit a voicemail comment to the Planning Commission. Their meeting is on Thursday. Is that tomorrow? That's tomorrow at 7 p.m. And these voicemails will be played out during their meeting, which also will be live streamed, so it can be viewed. And I have the link in the toolkit if you wanted to be present. So we have also sample in that toolkit, some sample comments. You should adjust with your own voice, but just with some talking points. And is better than or. You can email a comment to the Planning Commission so that they receive it before their meeting tomorrow. And then there's also ways and links to email Governor Newsom. And if you live in Kern County, which I'm not sure any of us here in this meeting, but if you know anybody, then you can email directly to the email on the toolkit. But yeah, and then hopefully we will be able to stop this. And then the end of March, there's going to be similar for Los Angeles. We're not as bad as Kern County, and then I was a resident at UCLA. And whenever we would get a transfer from the Bakersfield area, that was just a bad prognostic indicator. Basically, we all knew they either have cancer or they're gonna die, when it was always like the sickest, most horrible cases. And nobody said out loud, I don't think we were really aware, or it wasn't really like now, we knew it was polluted, but we didn't really, wasn't sort of an environmental awareness. It was just like, oh, those poor people who live there. But now I think we're all much more aware of how this all comes together and happens. So.
And just to put in one more plug for what Karina said, just to underscore it, we would love to connect with health professionals in Kern County, either as Climate Health Now or as any other just in any capacity. So if people are connected to health professionals there and could facilitate, we are all ears.
I sent it to the pediatrician that represents the AAP.
Oh, sorry, I don't know who's.
Trisha.
Yeah, I'm on the local board, and there is a person, so I sent it to our executive director to send to him.
Awesome.
Trisha, remind me where you live?
I live in Santa Monica, but I'm on the executive board of AAP for
Wonderful.
Chapter 2, which is LA and the 7 counties there.
Yeah, awesome. Thank you.
What is the name of that person, Trisha, just really quickly?
I think his last name is Biggs, John Biggs.
Oh, I don't know. Okay, cool. Thank you.
Wonderful. So I signed the petition, and then if you can share it on Facebook too, and Twitter, that's another way to boost. So Karina, should I go to the next slide?
Thank you.
Okay. So wrapping it up, we wanted to share some upcoming events that are exciting. So our Stanford allies are putting on the NorCal Mini Symposium on Climate and Pandemic Resilience. And on February 18th at lunchtime, Dr. Renee Salas is speaking. Lisa, would you want to speak to that at all?
Oh, sure. Yeah, so it's just going to be kind of a check-in point for the year, with the thought that we're going to plan a second symposium in the fall, hopefully expanding our partnership to other medical institutions in the Bay Area. And the sort of the global hope for the symposium is to bring all of the amazing groups in the Bay Area with academic centers to kind of have a combined conversation on what folks are working on, more focused on healthcare and hospitals, to kind of create community around that issue. So Renee Salas is going to do probably about a half-hour talk, and then we're going to break into 6 groups, and it's purely socializing. There's not really going to be an educational component to the breakout groups. It's just an opportunity to network and check in.
And if you haven't heard Renee Salas, she is impressive.
Yeah, absolutely. Yes. And then the Climate Center's Climate Safe California webinar about phasing out fossil fuels is coming up on February 23rd in the morning. And so we will share, if somebody wants to put a link to that to register in the chat right now, and then we'll share this in our monthly newsletter, which will come out sometime this week. And then, as we spoke about earlier, so the recess for California legislators is March 26th to April 4th. And so around that week of their recess, we will be organizing the meetings where we show up as doctors and nurses in California as Climate Health Now representatives, sharing our concern for health and asking for their urgent action on climate. So look out for opportunities to be a part of that. And the people who you just met in your local hubs will be your teams to schedule those. And then we'll also for sure work with our local organizational partners in those meetings. And then for anybody who might be interested in April, late April, the Planetary Health Annual Meeting is scheduled. You can't register for it yet, but I just wanted to flag it because there's a lot of really awesome speakers from actually across the world. And then we have Climate Health Now has a podcast, and it's called Courageous Medicine for the Climate Health Crisis. The episode that came out last night is my favorite ever. I interviewed, for those of you who may have seen his TED Talk, Dr. Anthony Aiton, and we talked about racism and the climate crisis and democracy. So you can, if you just search Courageous Medicine on Spotify or Apple Podcasts, it should pop up. So please listen and subscribe and tell all your friends. And one of our ally groups, Medical Students for a Sustainable Future, also has a podcast for health professionals, which we encourage you to check out. And then wrapping up, so as you're talking to colleagues today and you say how awesome this meeting was, they're going to want to join, and we want to grow because we want to cover California with a web of climate activated health professionals. So the way to invite new members to join is to send an email to caclimatehealthnow@gmail.com and to just introduce them. So say, this is, my colleague at work and she's a nurse and she lives here and she wants to join, and then we'll loop them in. And just one more plug for how important the demographic form is. So if you didn't get a chance to do it during the meeting, if you could take a moment right after we wrap up, it would be really, really helpful, because that's helping us to take an inventory and really build our teams. And we look forward to seeing you in March. And in March, we're back to the lunchtime hour, which is 12 o'clock on March 10th. And so we're alternating morning and afternoon so that as many people as possible can join. So I think that's about it.
Yay, thank
you. Yeah, any last minute announcements or comments or anything?
I just put in the chat that Climate Reality Leadership Corps is having a virtual training coming up, and they're free. You do have to apply, and it is hosted by a former Vice President Al Gore. But it's about a week-long training. They used to do them in person, but now they're virtual because of COVID. But Anyway, and so I've got the link in the chat. And
Yeah,
thank
thank
you
you.
guys. Thank you, Ashley, Amanda, Karina. You guys have done a great job. Thank you.
Yeah.
Thank you, everybody. You're all,
Yay.
we thank you for all of your contributions.
I'll just say this. I did the CRP training live, but I've heard some people who've done the virtual as well, and I've never heard anyone say anything other than it being fantastic. I don't know how many people on the call are already done it, but
than during that training.
Ditto.
I registered for it, and it's cool because you can do it at your own pace across the week. So I'm definitely going to take it. I think it's in April.
Yes, April 22nd to May 2nd. My daughter took it virtually over the summer. So she started a chapter at her university in Washington.
Nice.
The first student chapter in the Pacific Northwest. So anyway, it's a great thing.
Yeah, so right after Earth Day. And we'll, thank you, Ronnie, for bringing that up. We'll keep it. Any other announcements?
Just say the name of that training again.
Climate Reality Project. Al Gore.
And we'll include a link to it in our summary, Tom, for sharing out. Yeah.
And Tom, a link is in the chat.
Yeah. Wonderful. Well, thank you all so much for joining. You give me hope. Have a great day. We'll be in touch.
We make our hope.
Bye, everybody.
Bye, everybody. Stay well.
Likewise.
Are we staying on?
I think it's a different link.
Okay. Bye.
Bye.